Hi, welcome to Case of the Day. This is Dr. Bhavin Jankaria, and today we have the 49th case, simple one, classic pleural calcification and calcified fibrothorax. So, the 67-year-old cough, dyspnea on exertion, fever for 10 days, history of TB 35 years ago, treated and no other details. The chest radiograph is classic. You see this calcification, this is classically pleural, there's indrawing of the ribs, there's a reduced size of the lower hemithorax, and this typically occurs following TB pleural effusion and empyema. The lung windows here show some post-infectious changes, a little bit of inflammatory bronchiolitis, which may need to be investigated for NTM, but that's not today's focus. And here is that chunky calcification with subsegmental atelectasis of the subjacent lung. And you can see that in all its glory in the mediastinal windows, a thick calcification involving the visceral and the parietal pleura, retraction of the pleura from the chest wall, the changes in the adjacent lung, the contracture of the hemithorax, the crowding of the ribs. See the reduced AP diameter here, the reduced mediolateral diameter. And then on the right also there is a little bit of diffuse calcification thickening with a focus of calcification. Again, beautifully seen on the coronal and sagittal images. So fibrothorax is a severe form of pleural fibrosis where there's calcification, and this results in contracture of the involved hemithorax and reduced mobility. And while tuberculosis is the commonest cause, there are these other causes, and there was this one case report from AJR-CCM in 2017 because of SLE. Asbestos does cause this, but not to the extent that we see with tuberculosis. And so, unless there is a reason to think of other etiologies, TB would be the commonest as we see here. Now, this is classic. I don't think anything looks like this otherwise. And so, pathognomonic for pleural calcification. And we've discussed post-tuberculosis lung disease or PTLD a couple of times in this YouTube series. That's another patient. Again, not an uncommon appearance. You see the retraction from the chest wall. This is not fluid, though it's hypodense. If you put a needle inside, you're not going to get fluid. In these chronic cases, this is just fibrous tissue that looks hypodense on a contrast CT. So calcified fibrothorax is not uncommon in India, has a typical chest x-ray appearance, and the chest CT is usually done to see if there's other active disease or to just reconfirm or reaffirm the findings. That's the Leadership Summit. Please don't miss it. That's the WhatsApp channel, and thank you so much for listening to this.